So when I do that, we're able to have the patients heal faster, use less pain medication, and have less post-op complications. And I want to share with you the secrets, and that's how you smile at the surgery. Yo, what up? It's a tip of the week, and today we're gonna jump into the mouth, or into a panel to be specific, to talk about coding. All right, guys, so if you're new to the channel, I'm Dr. Jared Williams. I'm a concierge dental surgeon. I go from office to office doing surgery, such as implants, third molars, IV sedation, and even coaching. And so today, when I was going over my tips of the week, I was just like, wait a second. Dr. Jenkins asked about coding. It was interesting. He took our course and he's talked about how he learned more in 30 minutes of the course than he did in all his 4 years of dental school. Guys, don't take my word for it. You need to be the next success story in the smile after surgery family. All right? So let's jump into it. So today we're going to be talking about coding. Guys, coding is super important, because the reason why coding is so important is because, number one, you want to make sure that you are going to, number one, like, subscribe, and hit the share button immediately right now. All right, like, subscribe, and hit the share. So the reason why it's so important to code correctly is because, one, you don't want to underdiagnose and you don't want to overdiagnose. Both of those are problems. All right, man, something's in my eye. So you don't want to overdiagnose, you don't want to underdiagnose. Both of those have their issues with them. All right, so right now I'm going to share with you this case that came back via insurance. So we coded this, my team coded it, they got it back to me, and the insurance said, hey, these teeth, as you see right here, 1, 2, 3, and 4, are not 72 or not completely bony impacted wisdom teeth. They're actually, well, the office asked me, hey, doc, what do you want to do? Refer it out or do the case? When I looked at the reimbursement and I looked at what they were trying to do, I was like, I'm not touching that. Like, for the reimbursement and the amount of headache that could potentially happen. And like I said, this case right here, probably taking about 30 minutes to get all these teeth out. And for you, probably take you about 45, add another 15 minutes on it for you to take the course. So you could knock this whole case out, maybe 15 minutes, 60 minutes, an hour. That's including sedation. So with this right here, I looked at it, I was like, I'm not touching this crap, because number one, the insurance company can be a problem, all right? It's always us versus them, and I want you to get on this side so that you could literally take hold of your treatment. So when I looked at this case, I'm like, I'm not treating it. And I don't think the patient was going to pay the remainings, and then it's just a hassle, because if you take the more than what you agreed to have the patient pay for, then it's a hassle. So I was like, I'm not doing it. And number one is just like, they coded it 4 times lower than what it actually is, and I was just like, it's not worth it, man. All right, so number one is this. We're gonna go over different codings, and I'm glad that we have this x-ray, because what it's gonna do is gonna give us everything that we need. All right, so as you can see right here, these are 7240s, and the reason why I call them 7240s or completely bony is because more than 50% of the crown is covered in bone. All right, more than 50% of the bone, more than 50% of the crown is covered in bone. So when I look at this x-ray right here, I look at this aspect, this tooth right here, I look at this tooth right here, and you can see that, yeah, there's no bone covering the occlusal surface, but this is a 2D image. And when you look at 2D images, what it does, it's a slice. And so as you can see, the bone just doesn't stop here and come up. It doesn't do that. It goes all the way across. So this is where this cervical margin is for the teeth here. And so it's just literally going to continue carrying forward, just as you can see here, right? Same thing here. Here's the ascending ramus or descending ramus, and as we come down, the bone is basically going to be there and here. So this is pretty straightforward. It's a 7240 or complete bony wisdom tooth. Hey, are you a dentist struggling with extractions? Well, guys, do you want to take out cases like these or these? Well, guys,
look no further. I have a 21-day challenge. Well, let me back up. I'm Dr. Jared Williams. I'm a conscious dental surgeon. I've done over 10,000 surgical procedures. And all I do is do surgery. And I've seen that there's individuals out there just like you that are wanting to do more with surgery. Disregard the cap right here. Focus on me. What I want you to do is click the link down below so that you can do cases like this and this. And so that you can have more time, offer more procedures, and be the best dentist in your area. Click the link down below. Make it a great one.
Now, there is another code, it's a partial boning. So if complete is 50%, then partial boning would be what? Less than 50%. So in this particular situation, if the bone actually was like here, then I would say that that would be a partial bony impacted wisdom tooth. But like I said right here, the cat's out the bag because this is a complete bony and partial bony is less than 50%. And you can see that this covers up. The difference between a partial bony and a complete bony could be anywhere from $80 to $130, $150, depending on where you're practicing. So just keep that in mind when you are actually doing and treatment planning, because less time, I want to put more money in your pocket, and I want you to be able to be in a place where you can consistently thrive. So anyways, as you can see here, partial bony is less than 50%, complete bony is more than 50%. All right, so when it comes to soft tissue, my mentor taught me this and it was amazing. I was kind of blown away because I was like, that can't be. Well, it is. So anytime there is soft tissue on the occlusal surface of the crown, that's a soft tissue. So even if you have a patient that their wisdom teeth are are fully formed, and they're like, hey man, I still have a little bit of tissue I still feel a little inflammation back there, and there's a little teeny bit of soft tissue that's on that occlusal surface, make sure you coat it as soft tissue. It may be look at as surgical, but it's not, guys. Make sure it's a soft tissue and you get coated and you get reimbursed correctly. Also, a surgical extraction could be this one right here. This one doesn't have any bone and the tissue, and it's fully exposed into the mouth. And so when that happens, this is going to be a surgical extraction. Now, when you take my course, or should you decide to take my course, you're going to see that a lot of the way in which I take out teeth, I very seldom use a drill, right? Surgical burr, very seldom, because a lot of the cases I want to do them atraumatic as possible. So when I do that, we're able to have the patients heal faster, use less pain medication, and have less post-op complications. And I want to share with you the secrets, and that's how you smile at surgery. So in this particular situation right here, I would apply this as a surgical extraction. Now, just because I show you my system on how to not cut bone or cut the tooth or different things like that doesn't mean you need to coat it that way. And that was another thing my mentor told me. He was just like, when you're doing these cases, do it as the general population of dentists would do them. Most dentists would probably would cut bone and section the tooth and all these different things. The way in which I teach you is going to get you in and out and less headaches. So this would be a surgical extraction. When you start getting into any time, so surgical extraction is defined at when you have to cut bone or cut the tooth. That's considered a surgical extraction. Anywhere in the mouth. So I just wanted to give you some insight because that was something that came up, and I know that this is not something that you're gonna see consistently, especially if you're not doing them. But like I said, should you decide to take the course, you're gonna learn more about the different other codes that are out there so that you can make the top reimbursement for more bang for your buck. And I was gonna tell you, so when I got this case back, they told me that they downgraded it. And can you guess what they downgraded this case to be? You know what I'll do with this? For the first 3 doctors, and you gotta be a doctor, right? For the first 3 doctors that answer this question, I'm not gonna tell you what insurance downgraded it to be, but the first 3 doctors that code this correctly, what I'll do is this: I'll give you an opportunity to come shadow me free of charge. And what you have to do is you sign up for one of our courses on third molars, because this is what I'm doing. If you decide to do more, then great. But if you sign up for our third molar course and you take access to it and you answer the question correctly, I'll give you an opportunity to come and shadow me. This way you could see it live in action, how we're able to take these teeth out. So there you have it, guys. That's my gift to you, just because you're taking the time out to get better and also wanting to treat your patients and take their level and their experience to the next level. So yeah, so anybody that determines, the first 3 doctors that let me know what is the right coding that the insurance downgraded this to and puts it down below, what I'll do is this: I'll have my team reach out to you after you purchase the third molar course, and what we'll do is we'll have you fly down, you come down and observe me and shadow me in office wherever I'm in the city, and you'll get to see how we get these teeth out just like that, how we have the patients smile after surgery, and you get to see how the patients end up writing their reviews and seeing like, man, this is legit. All right, guys, so there you have it. I'm Dr. Jared Williams. I'm a concierge dental surgeon. I'm so glad that you took this time out to literally take your time out to come and take your skills to the next level. So once again, go down in the description, take the course, get the book if you need help with getting your patients numb, and take your dentistry to the next level. Once again, I'm Dr. Jared Williams, and my focus is for you, yeah, you, to smile after surgery. Make it a great one.